Good morning, everyone. Today is January 5th, and welcome to another episode of my um, newly minted baby podcast. Um, I had initially wanted to call this little video series Residency After Hours Car Therapy, but um, yesterday I decided that because the majority of the videos I've shot lately have not been in a car. Obviously, it's too cold outside. I was gonna rename it something else. I was gonna call it Physician Heal Thyself because I think this is what I'm doing. It's just self therapy and talking um, about different things and different feelings and situations. So, welcome everyone to the I believe, fifth episode of Physician Heal Thyself. Um, Last night, I went back to work and had a pretty luckily uneventful evening. Uh, One of the nice things about overnights, which I've always loved, I worked overnights as uh, before I went to medical school for 6 years, I was a clinical lab scientist. I worked in a blood bank at various hospitals, and a lot of my work hours were overnights, with the exception of the year when we were hit with COVID, which was also the year I started medical school. One of the things I like about overnights is that everything, for the most part, slows down. The number of people in the hospital thin out. Um, it's relatively not busy until it is. So you can slow down, take time to do a number of different things. The downside to it is that it is the middle of the night. You have messed up circadian rhythms, which I know is going to happen this month with me. But one of the nice things about working at night is that you get to learn different things at a slower pace. The biggest takeaway for me from overnights, with the few 24-hour calls that I've done, and with working yesterday, is that overnight shift is mostly about triaging what should be addressed at night, right? We had a patient that came in yesterday with a fall. However, while they were doing the imaging, because when you come in as a fall patient, they have to do this whole workup thing, where they do labs and then they do imaging depending on what they think that is necessary, um, from the ER or from like a trauma standpoint. But while they were doing this patient's workup, it was found out that they had a vascular issue which required a consult to vascular surgery. And when you're on overnight and you're the surgery resident or surgery intern or surgery chief, you get to take calls from all the surgery services, and vascular surgery was one of them. And this was something that, looking at it from like a initial approach, you would think that it's something that would be dealt with as an emergency. It was a problem that the patient was having with one of their big blood vessels, that could potentially be life-threatening, devastating, but the patient was well known to the vascular service. This was a chronic issue. It's not something that we really could do anything with in the middle of the night at that time. The patient wasn't experiencing any symptoms from that. That's not what brought them into the hospital. So we saw them, and it ended up just being something where we would say, okay, we're going to keep watching. We know you. This is not something that we are dealing with right now. Right now, the big thing that we have to manage is your high blood pressure and to figure out why you fell at home. So one of my big lessons that I'm trying to cultivate, like especially on the overnight shifts, is given the resources that are limited at that hour, because the resources are limited. It's not that they're not there. We have our surgeons that are either in-house or at home, depending on where they take their call, where if there's a situation like our other patient that we had who came in with like signs of appendicitis with the imaging, but they only had like a little bit of a stomach pain. Didn't really have any like bad labs that would make us worry about taking them to the operating room. So we gave them antibiotics. We tried to schedule the surgery. We didn't have any space for today, so we would be doing it tomorrow. And our surgeon at home was like, okay, if we can do it today, I'll come. If we can't do it today, then we can wait 24 hours. This is not a life-threatening thing. It can be managed with antibiotics. Which, as a person who has had their appendix removed, I had an appendectomy when I was 14, right before I came to the States. And I think at the time, the solution to all appendicitis was that you take the appendix out. Recently, there have been these changes where depending on like how bad the appendix is, or like, if it is something where the patient doesn't need to immediately go to the OR, you can manage appendicitis with antibiotics. Or if they're on the other spectrum, which is where like your appendix is burst, which is something that when I was little and I had appendicitis, this was like supposed to be the most devastating thing. If your appendix burst, oh my God, you're gonna die. The reason with that is that if your appendix burst, then the infection could go into your bloodstream. It could cause what we call sepsis. But these days, even with a burst appendix, because the area is so inflamed, because the area is so like jumbled up, you can't really go in and try to be poking around to take stuff out. So what we do is we do manage that also with antibiotics and drainage. It's just all these really cool things about medical advancements that you see. And we got to take care of this other patient, which is antibiotics. And, we would revisit their surgery either tomorrow morning, or if they have gotten much better and they're not feeling any more pain, they get to go home. So my big lesson for overnight, especially for this month, is to learn how to triage things that will come from the emergency room, consults and things like that. What is emergent? What is urgent? What can wait until the morning? So that was a pretty easy day for me. I was able to study a little bit, do some questions, catch up on some emails, look up a couple of different things here and there. I was also prepping for my first doctor's appointment in about, I don't remember, I think maybe 8 months or so. The last time I saw the doctor, I was at Madigan and I was managing a couple of different things. I have a shoulder injury that has continued to persist, and I have an ankle injury that hasn't really gone away. So I was managing those things while I was there. And then with all other things, like I mentioned in my last post, that like my husband and I at this point in our lives were trying to see about starting a family. We just got here, so we were trying to establish care and things like that. So I went to the doctor today, and I don't know if any other healthcare person has the same like consternation, but it's always really weird for me as a physician to go to a doctor. I've always found it really strange. And on the video that I made yesterday, where I was talking about people being advocates for themselves, and one of the ways I thought that we could do that is by actually knowing our medical history. I always feel really awkward because there is always inevitably a question that they would ask me, and I would go, ooh, I don't know the answer to that. Today, the question was about pap smears. I had a pap smear with like the co-testing, which when you do that, it takes you 5 years, or as long as you're negative, you don't have to do it until 5 years time. I think I did mine 2 years ago, 3 years ago. I don't remember. I don't remember. I have moved around a lot between, first year of medical school and then rotations, being a transitional year, coming this way. It's been a lot of moves. So it's been a lot of like different doctors for different things. So I'm not entirely sure. So when I got there and they asked me the question about pap smear, I was like, I know I did it. I know it was negative. I can't tell you where I did it. I don't remember. So I'm going to have to brainstorm a little bit and figure out where that testing came from. The other thing that always fascinates me with visits for primary care and stuff like that is the whole height, weight, and BMI situation. Um, I before I left my house, because I do this every morning, because this is a weird gym thing. I don't know if all the other gym people do this. I weigh myself every morning, like when I get out of bed. I weigh myself before I go to work. Like I lose and gain a lot of water weight over the course of the day. But when I woke up from bed this morning, because I came home around 7, I slept until 9:30, and then woke up and went for my 11 o'clock appointment. When I woke up and I stood on the scale in my house, it said I weighed 182.3 kilograms, 0.3 pounds. When I got to the hospital and they took my weight, it was 188, which is a number that I haven't seen in like since maybe November of 2025. And then they did the height thing, and of course my BMI was 33. So now on my record it says that I have class 1 obesity. Being in the military, this was also another thing that would come up with the height and weight, because we get our height and weights measured in the military as well. And I remember there was a time when this was a big deal, because there was a discussion about like the really buff, really fit people in the military that would keep failing height and weight, because, you take a person that's like super muscular, who has put on all this weight, who goes through all the like AFT, ACFT exercises just fine. They breeze through all of like the medical fitness and stuff, and then they get to the height and weight, and it's like your BMI is X, Y, and Z. It's much higher than what we need it to be. So I think they got rid of the BMI in the military, and then they just started taping you. I've never failed a taping. The last time they did it, I think the percent body fat they needed you to be under was 33, and I was at 30% body fat. So I have never paid attention to the whole BMI situation. I know that it is disproportionately like looked at, especially for like minorities and African Americans and all of that stuff. And it factors into, insurance premiums and all of those things. But I just thought it was really, I don't know, I looked at it with a little bit of hilarity today, that I left my house, and I had one scale, and I went to, and of course, like the hospital, the clinic scales are still like, the chunky clunky scales that we've had from eons past. I just thought it was funny. I'm not particularly worried about it. I don't care about it. I know that I exercise well, I eat well, I don't smoke or anything like that. So I'm not worried about like my BMI being an indicator of like my cardiovascular health or anything like that. But it was something that I touched on that was kind of hilarious. And for me, it's hilarious because I know that it doesn't have any bearing on what I'm doing, but I think it is a little sad for people on whom, whose insurance and whose like views of healthcare are reliant upon that number. I think it's something that should go away. But I also know that this is a number, especially for things like bariatric surgery, that people do use to have eligibility for surgeries like that. So this is just one of those nuanced discussions that I think that just needs to continue happening in the healthcare field. Other than that, it was a pretty uneventful night. I'm hoping to have a series of uneventful nights in the next month or so, because as I mentioned before, I am going to take my AppSite in February. I am not very excited about it. I am going to be very vocal about how not excited I am about this. A friend of mine texted me. She's a radiology resident, and they are doing their own ITE, and she's also freaking out. So I know that I'm not alone. But I think it's going to be really interesting to see how I progress, hopefully, from like this exam to the other ones. And in extracurricular things, I wrote my first 2026 blog post of the year. It is published on my website, on WordPress, and it doesn't really say anything. It says the same thing that I said in the first video, which is that I'm overstressed, personally, self-inflicted. I'm trying to be very less serious this year. I am going to do a lot of goofing off. And I'm going to try to not have as much anxiety in my body as I have had in the last couple of years. Oh, the other thing I found out today while I was at the doctor's office, the physician who saw me, absolutely lovely. If we're being here long term, trying to establish a place, I think this is going to be a really good place to go to. But I was asking about therapy because I remember in my first video, I was talking about how I don't have a primary care doctor and I don't have a therapist. Now I got a primary care doctor. So I asked him about therapy. And what I didn't know is that I don't need um, a referral from my primary care to find therapy. There was a website which he directed me to, which was called, I believe it was Psychology Today, that you can look up. And it will tell you, like, based on your insurance. And for me, who has TRICARE, which is the military insurance, like, they also have TRICARE, so I can figure out if there is somebody there that will mesh with me, that I can see. And then he also mentioned a program, I think it was called Marvin, which is geared towards like healthcare personnel, where their hours are more flexible. You know, they have weekend hours, they have evening hours, and things like that. I don't know if my institution has Marvin. I'm gonna go check if this is something that you are, if you're a healthcare person, if you were looking for a place to go find a therapist. That's Psychology Today and Marvin. When I do the notes for these different posts, I will see if I can look this up, and if it's there, I will also put the links in the posts, if this reaches anyone and it is something that's useful for them. If you have come this far and listened to my morning and night of mostly nothing, thank you. What else do I have? I'm doing a book reading thing with my family. I started it with my nieces because my husband and I started a book reading thing last year. We're like avid book readers. And when I went to residency, I didn't want to stop reading extracurricular books. I'm going to put up a list of things that I read in 2025 at some point. But I'm starting off the year with 2 different books that I'm reading right now. The one that's on audio, it's a short book by the author Olin Steinhauer, and it is called Liberation Movements. I think it's book 4 in a series. And then I'm reading The Guilt Peel. I am sad to say that I know that the name of the first author is Jill, and I don't know their last name, but I'm also going to include that. So if you like reading, if you enjoy some book reading pastime, I will also be leaving recommendations for what I'm reading and what my husband are reading, because we do not we have completely different interests when it comes to books. All right, if you have gotten here, thank you for listening, thank you for watching, thank you for being my unseen, unpaid therapist of the day. I hope you have an excellent Monday. I hope you have an excellent week, and I will see you tomorrow.